G'day, my name's Dr. Andrew Pennington and I'm the practice principal and an integrative GP at Sanctuary Lifestyle Clinic. Sanctuary Lifestyle Clinic is focused on using lifestyle measures wherever we can to treat, prevent and reverse, if possible, chronic disease. And today I'd like to talk to you a little bit about diabetes, in particular type 2 diabetes. And many of you will be aware that it's commonly referred to as late onset diabetes and doesn't usually require insulin therapy at the beginning in particular, compared with type 1 diabetes, which is a completely different disease process really, even though it leads to similar elevation of blood sugar, and that requires insulin right from the word go. But type 2 diabetes constitutes nearly 90% of all diabetes in Australian contexts, and it's a predominantly lifestyle related disease that can be prevented in many cases and actually can be treated very effective with lifestyle measures. It does tend to progress over time, but with good attention to lifestyle, there are many people who can find that they can certainly delay any complications that may occur and in many cases prevent them entirely. The biggest problem really with type 2 diabetes is actually cardiovascular disease, heart attacks and strokes. That's the reason that type 2 diabetes is generally going to get people into trouble, and there can certainly be complications in other areas of the body, and we generally refer to these in medicine in terms of macrovascular, that's larger blood vessels, versus microvascular, smaller blood vessels complications. And as I mentioned, the macrovascular complications tend to arise around cardiovascular disease, heart attacks and stroke, and the microvascular complications generally occur in things like the eyes, where you can get diabetic retinopathy, which can eventually lead to blindness if not treated properly. You can get kidney disease, where you can get diabetic nephropathy, and again it can eventually lead to kidney failure if not kept under good control. And then also blood vessels in the limbs that may affect nerve or sensory function, or and in some cases then can predispose to ulceration in those areas because the blood supply is not being adequately entering the tissue and coming out to allow it to heal properly, and then that leads to complications of often amputation of toes or limbs. So what I want to specifically talk to you today about is to give you some hope. And I think many times when a person gets a diagnosis of diabetes, they feel that this is irreversible. The only way to manage it is to try and do a little bit of improvement with lifestyle, and then essentially you need to be on medicine for the rest of your life. Now, certainly that is the case in some people. We do need to use medications that improve the body's capacity to handle blood sugar, improve insulin sensitivity. Insulin is the hormone that essentially takes sugar out of the bloodstream and takes it into tissues where it's needed for energy production. But I want to talk to you a little bit today about how beneficial lifestyle changes can be in the management of diabetes. And I would say that it is possible in at least 50 or 60% of diabetes, type 2 diabetes cases, to actually halt that condition in its tracks and even reverse the condition to the point where the person no longer meets the criteria for a diagnosis of diabetes. If one is to do this, there is really two major things that need to happen, and they are an improvement in the person's diet and an improvement in the person's exercise. It's very rare to find that somebody who has a really good diet and exercising very well gets type 2 diabetes in the first place. I guess it's not impossible, but it's certainly much less common. And so we know, given that it's a lifestyle related disease, that we need to improve these aspects of our life to actually manage this condition. So what sort of things are we talking about? Really, with nutrition, there are a lot of common themes that come through that are good for many different conditions. And when it comes to diabetes, we find that as we increase the vegetable content in our diet, you will find that you tend to improve your diabetic control. And certainly we need to lower refined carbohydrates, and those are processed foods that break down very quickly into sugar. Things like soft drinks, white bread, white rice, things like this which will put a heavy burden on the body's capacity to deal with that broken down sugar. And when you have type 2 diabetes, generally you're not able to deal with those sugar loads as well as you usually could, because your body's tissues start not listening to insulin signals, and that's a problem. So we need to improve the insulin sensitivity in the tissues, and one way is to improve the diet. I can talk more details about that in another video. But another way that I really want to talk a little bit about very briefly, and I'll elaborate also more in another video, is around specific strategies in exercise. And again, everyone knows we need to do more exercise and we need to move. With respect to exercise, your muscle has almost infinite capacity to take up sugar. It just needs to be able to be told to do so. And that's where the concept of high intensity interval-based training or high-intensity exercise can be used as a very good therapeutic option for type 2 diabetes. If you'd like to hear more about this, I am going to elaborate it on in another video. If you have type 2 diabetes, or somebody you know might have type 2 diabetes, you might be a bit frustrated at the lack of progress in your condition using conventional medications, but you realize that you need to make a good lifestyle change. Certainly you can talk to your doctor, and if your doctor or dietitian is really on board with helping you, I'm sure you'll do very well. If, however, you want somebody who's even more focused on lifestyle, why not come to Sanctuary Lifestyle Clinic? And you can click on the descriptor of this video below. You'll see our website, sanctuaryclinic.com.au. You can book an appointment through there, or you can go to our Facebook page, Sanctuary Lifestyle Clinic on Facebook, and click on the Book Now icon. Or of course you can call our phone number 1300 723 070.